Hello everybody, I'm Dr. Michael Brown with onstageRx.com, your source for patient video education. Today's topic for education is vitamin D and vitamin D supplementation. To first begin, let's talk about what vitamin D is. Vitamin D is a hormone, and it actually starts out as a prohormone, and it's actually produced in your skin through sunlight exposure to your skin. It's then converted into the liver into an active hormone that helps increase the calcium absorption in your gut and also increase the calcium levels in your blood. That's about it. There have been lots of different studies trying to see if vitamin D was involved in things such as diabetes, depression, energy levels, high blood pressure, and unfortunately, most of these studies are showing us that supplementing somebody with vitamin D just doesn't have any effect on those different things. So, how much vitamin D do we actually need? Well, it's shown that you only need about 600 units of vitamin D a day if you're under 70, and if you're over 70, 800 units. Now you might think, is there a problem with too much vitamin D? We used to think no, but we're actually having more and more studies come out and show us that excessive vitamin D, especially over 4,000 units, which commonly can be obtained over the counter, is actually leading to cardiovascular disease, renal disease, and many other problems. So it's strongly recommended that we keep our vitamin D levels at the normal recommended daily values. Now, why all the hubbub with vitamin D? Well, there were some older studies that showed that people that were depressed or fatigued would have low vitamin D levels. So immediately we thought, okay, it must be the vitamin D causing that. Well, this is a classic case of what we call correlation versus causation. Causation means something causes something else. Correlation just means in this population, these people have the same characteristics. An easy example would be in the middle of the summer. We know that crime is more elevated in the middle of the summer. Well, we also know that popsicle sales and ice cream sales are also elevated in the middle of the summer. Now, do ice cream sales cause more crime? No, it's just a correlation. They both occur at the same time, but one doesn't cause the other. And unfortunately, we've shown in multiple studies now that when we supplement people with different disease states that we thought vitamin D would help, we're showing that it doesn't really make that big a difference. These are things such as asthma, COPD, fatigue, diabetes, hypertension, menopause symptoms, nonspecific muscle pains, osteoarthritis. Supplementing vitamin D in all of these populations has been shown with multiple randomized control studies to not make a difference. So because of this history of vitamin D, it became very common that doctors would just screen for vitamin D. Do you need screening for vitamin D? Well, it's actually recommended now by the United States Preventive Task Force to not screen healthy populations for vitamin D because we know that supplementing it or replacing it doesn't make a difference. There are a few exceptions to this rule. That would be people that have disorders of their gut, liver, or kidney and make it hard for them to process or metabolize vitamin D. Those people could benefit from vitamin D screening, but again, the evidence is still pretty lacking as to whether or not it makes that big of a difference. Another patient population would be those that are elderly that may have recent bone fractures. But again, there's still limited evidence that vitamin D supplementation makes a difference. So most major medical organizations now are telling you not to routinely screen for vitamin D. Why? Because if we replace it, it doesn't make that much of a difference. And if it doesn't make that much of a difference, then we're just wasting our money. How much money? In 2014, over $300 million was spent by Medicare screening for vitamin D, a supplement that unfortunately, when we give vitamin D, we're not showing much return on our value. So if it were my choice and my patients, I'd make sure you talk very closely with your primary care doctor and see if you really do need that vitamin D screening, because it could be that you're in that healthy population that's not really going to experience any benefit from it. Remember, exercise, hard work, good diet still make the best difference in our lives. Again, I'm Dr. Michael Brown with onstageRx, and thank you for tuning in. Please tune in and follow us so you can see all our many patient educational videos that we have available for you. Thank you.